Hello, everyone. This is Dr. Bijoor with Oakview Medical Associates. I hope everyone's doing well this Saturday afternoon. I just wanted to speak out to a lot of people at the same time, and I thought I'd do a quick Facebook Live. What is going on right now, globally, within a country, and within our community, is something that none of us might have even imagined or thought that it would happen in our lifetime. As a healthcare provider, I am oftentimes the first one to tell a patient or give them some news that they've been unaware of. I think as a community, it's really important that we all take this opportunity to come together and to practice a few things that, although we may not see it right now, will make a big difference in the long run. Whenever we are faced with an infection of this magnitude or proportion, it really takes a village or an entire community, entire country, states, and a lot of cooperation between countries to come together to contain such a highly infectious virus and global pandemic as we're seeing right now. And I've gotten a lot of questions over the last week about, what we should do. Should we take this seriously? Should we be really staying at home all the time? Even my kids have asked me, and I think the right thing to do at this time is to really be a little bit extra cautious, a little bit more in the preparedness field, then rather than being more reactive. I would like us to see that we're more proactive at this point. And so I'm just going to touch on a few things. First, I'll touch on a little bit of what we know is going on. And, even as healthcare workers, I often tell my patients, and you all know this, is that we are in the science of taking care of human beings. We are not global or miracle workers by any means, and we try to do the right thing. And many times we have certain guidelines that would point us in the right direction, but we don't have, medicine is not really an exact science. So a lot of times our what we tell others or what we advise is based on what we know, and what we know is oftentimes based on data. So in a situation like this, where we have a lot of data coming in, I think it's really important. Sometimes, day-to-day things are changing. And in speaking with my healthcare colleagues, workers around, I have friends I went to, conferences with, and I've kept in touch with all over the world. And all of us have this common consensus right now that we need to do everything possible in our lives, in our daily lives, with our children, to really take this seriously. No panic is needed. There's no need to start hoarding items and doing a lot of extra things that just consumes our energy. It's really important that we preserve our mental energy, our physical energy, especially if you're in healthcare. A lot of colleagues, even my family members are completely in the front line seeing sick people every day, have admitted patients with the COVID-19 disease, the patients that are fighting for their lives. And we have healthcare workers that are just, we don't even think twice about it. We just go in and do what we need to do to take care of that patient. But looking back, when I'm a lifestyle board certified physician, so a lot of what I do is really in inducing behavior change in a person. And to me, that is very, very important at this time. Yes, there are questions about medications coming in to treat this COVID-19 disease. There are vaccines probably in the pipeline, but all of these are not happening today. What is happening today is in a couple of steps. We have a virus that is transmitting person to person through what we know to be droplets. There's some speculation that there are some other modes of transmission. From what we know from our China and Italian and European physician counterparts, that we have a lot of professional groups, so we're in touch with and getting a lot of knowledge from the way they're dealing with things. We know that this virus is rapidly transmitting. It's a virus that traditionally lived in the animal host, in bats and other animals, and now we're seeing it in human beings. So naturally, it's something that is not overall used to the human host, and so it most likely is unpredictable. And it's really important at this time to practice some things that I would say are your, should be our principles right now as community members, our civic responsibility, so that we can do whatever it takes. Even if we don't get seriously sick, we could be transmitting the virus. So the number one thing that I would say at this point is to stay at home as much as possible. I've had a lot of questions from people I know whether it's okay to go get a haircut, or is it okay to go, I just forgot one thing in the hardware store, is it okay? I mean, these are things, if you can delegate to one person that can go and do a couple of, go to one store instead of going to a lot of different stores. Just try to keep it minimum, because I think we have to be prepared. I mean, it may be that in the next week or a few weeks to come, we may have to do a lot more of this, just taking a lot more added precaution. So what we know is that if we all isolate, then the virus obviously doesn't get a chance to transmit person to person. And that is one of the most effective tools we have, or our defense against this viral infection that's going around. Currently, if you look at our CDC and DHEC data that's coming in, sc.dhec.gov, you can get a lot of information on the real-time numbers in different states. What we know is, as South Carolina, we are, currently in the under 100 cases identified at this point. But the states around us are in the 100 to 500. So if you look at North Carolina, you look at Georgia, they're already in the 100 to 500. My physician colleagues in several other cities around our state have mentioned that they're actively taking care of people that have come out positive. So is it just a matter of time before it will come to our area and infect a lot more people? Most of us that have a good immune system will be able to recover well, most of it just like a viral infection. But although we may not get sick, we may actually transmit it to somebody that has a low immunity. So look at it like a social responsibility, not just, you may think you're in best health of your life or what have you, but I think we are so interconnected as human beings. We're all the same. We may be living on this part of the planet, the other part of the planet, but when it comes down to it, we're all actually part of the same little speck known as Earth, in one of the smallest galaxies, and there are trillions of galaxies by mathematical calculation. So we're really, we're so significant yet small, and we're all connected to one another. And I see this a lot in daily practice when I talk to people from all different backgrounds. We all have similar things. And one more thing, besides staying at home and practicing social distancing, is to really at this point make sure that in your home, if you're accepting a package or you're touching any boxes that may have been handled by other people, that you really wash your hands before and after for at least 20 seconds. Maybe just making it like a routine for your family to wash your hands, anyway with soap and water, and make sure it foams up nicely, and do that for about 20-25 seconds. A simple thing is to just sing the song Twinkle Twinkle Little Star twice, or Happy Birthday song twice. Just little tools there. And the other thing is take care of your hydration. Drink lots of water. We know that this virus usually is through respiratory droplets, so it would really minimize you getting sick if you were able to gargle or wash your mouth, drink the water, frequently, and that'll kind of keep your the time of contact with the virus down, and hopefully wash it out of your system. One tool I think of is, anyway, I tell all of us to drink a lot of water, and I'm certainly guilty of not drinking enough water when I'm working, but maybe try to have a glass of water every hour or so. That way you're doing it more consciously. That's a good idea. Another thing is to have lemon water every day. So fresh lemon, if you have access to that, or lemon juice, but the fresh lemon would be ideal. Just squeeze that in some lukewarm water and drink that every morning. that has a high concentration of vitamin C. It also, lemon, although it's acidic outside, when we ingest it, it actually turns our body alkaline, and that helps boost our immunity and fight viral infections. Another one is, at this point, all of us that, if we have any smokers in our family, this would be the time to quit. What we know from the viral infection is that if it does cause the disease in your system, it tends to cause a very rapid inflammatory response in your lung bronchus, or the bronchioles, the small tubes in the lungs, and they rapidly fill up with thick secretions. And there's a lot more, scientific information on how ultimately the patient ends up getting respiratory distress syndrome. But to keep it simple, prevention is the goal, and we don't want you getting sick. We want you to be able to have a good immunity and to be able to practice some good hygiene, good preventive steps, so that you don't end up getting the disease, right? Majority of us, if we do get sick or infected, we will be able to fight that off. So just keep this in mind. And the other thing is, this is very important for healthcare workers, but for everyone in general, is when you go in and out of your home, if you happen to go somewhere outside, when you come home, the first thing you must do is firstly take off your shoes outside. A lot of us in our culture, we don't bring shoes into the home anyway, but keep that outside, and keep a kind of a designated spot in your garage where you can put a jacket or something, that you've worn overall, that you can just take off, go straight to the shower, and make sure you shower down, just take care of yourself, and then mingle with your family at home. Also, covering your cough or sneeze is another very important one. Right now with the allergy season, how do you know, is it allergies or is it the viral infection? The thought is that a lot of people actually have the infection and are not symptomatic, so they're not really presenting with the symptoms. And we sure in our medical community are seeing a lot of people in the office with very similar symptoms. How do we distinguish? Is it just allergies, or is it the coronavirus infection? Right now, if you have, recurrent sneezing, recurrent coughing, most of us are anyway getting to stay at home. So I would recommend that you do that as much as possible, and don't go around thinking, oh, it's just allergies, and just, take it lightly. Because, allergies have been around and always be around. But right now we're dealing with a serious viral infection going around. And so I think it's more prudent to make sure that we take the highest precautions with that as well. One more thing I want to touch on, I don't want to keep this too long, because a lot of my people wanted me to put something on Facebook just to speak about two things I would say right now are vitally important. If you as a general community member have extra face masks or gloves or disinfectant wipes, if you are hoarding them, if you have a it's basic supply, that's fine. But if you have anything to spare, essentially we might have a situation where we may run out of these essential personal protective equipment that the healthcare workers need. And this is not just physicians and nurses, but I'm talking about everyone in the healthcare field. We have radiology technicians, we have patient care technicians, registrars, everyone on the floors in the hospital. Everyone is doing such a wonderful job, but we need to take care of all of us in the healthcare system. So please do, you can drop them off. I've been so blessed this last week. I've had some patients who actually are pretty sick themselves, but they realized that they had a little extra supply and they brought it in. And that is really touching to know that we are all so kind and caring to one another. That was really nice. The second thing is that it's really important to keep a good state of mind, not just as healthcare workers, but as general non-healthcare community members as well. We know this too shall pass. I mean, I'm always of that thought process that we as human beings are very resilient. We're built tough, we're built strong. We have reached the moon. We have done several things in our lifetime, and this will not be the end. There will be a lot more things happening for us as a global community, as a country, as a nation, in our state, and in your little home. I mean, you have a lot of things that you will be very proud of, that you will achieve, your children will achieve, but keep a good state of mind. That's really important. Do whatever the guidelines recommend. Do whatever your government recommends. Follow these things, because It takes all of us together to make something happen. And don't underestimate the impact that you can have. Each one of us is responsible. And if we have a weak link, like we have in the vaccine world where certain people don't want to get vaccinated. I mean, I know personal choice and I understand that, I respect that. But a lot of times we then see little weak links in the whole effort, and it becomes more difficult. And then we don't want any one of us getting sick. Whatever our philosophies are on life, we're all the same. We're all on the planet together. We all need to make it, because if it affects one of us, it affects all of us, actually. I mean, it's just shocking to see some videos of some patients in Italy and in England suffering, some young healthy people suffering with the disease right now. It's really important for us to be calm about it. And I actually always tap into some good breathing exercises that I've learned. Been very blessed to learn through my childhood and through really good parents that have taught me the importance of good spirituality in our routine. I think one thing I always, I've kind of conditioned myself is to be calm. Anytime I'm faced with anything, people ask me, how do I manage so many things? I'm just like everyone else. I'm also trying my best as a mother, as a sister, as a daughter, as a spouse, wife, and as a physician. And I think all of us need to realize that you have to have some sort of tool in your system. It could be prayer, faith, deep breathing, meditation, spending time with your loved ones at home, reading a good book, listening to a good podcast, listening to music. There's so many different tools we have, and this is the time to tap into that. This is the time to really sit back and reflect on yourself, how you've been doing. Maybe this is just a way of everyone saying, stop and take it easy for a little bit. And that's what I'm trying to do this Saturday. So I thought I'll just tune in and talk to everyone. I really appreciate everyone for listening to me. I hope it's some good, valuable information. Next time I want to touch on an actual breathing technique that I did air on TV 2 weeks ago, but I want to go into it in more detail, because the whole point of this is to have a simple breathing technique that you can practice even when you're speaking to others, even when you're faced with a stressful situation, and not make it a long drawn out thing. And the reason breathing works is when you focus your awareness on a simple act of breathing, you actually invoke your autonomic nervous system, and you heighten your parasympathetic nervous system. There are two types of autonomic nervous systems. I won't go into the details right now, but all of us that present with gut issues and irritable bowel syndrome and skin rashes and a lot of things that don't fit one disease actually have a dysfunction in the autonomic nervous system. Sympathetic is more fight or flight response, our response to stress, our cortisol system. And then you have the parasympathetic, which is responsible through the vagus nerve to really calm your system, to slow down your heart rate, to conserve your energy. And so having, most of us are in that flight or fright response, but to really get into that parasympathetic, one of the medium by which we can achieve that and achieve really good health in the long run is by practicing some breathing techniques, some meditation, focusing. And I truly believe that is the foundation of everyone's health, and physical symptoms are a manifestation of internal disharmony in our health. So once we really can tap into that inner awareness and the inner consciousness, I think it's much more effective. So for now, I hope I didn't go into too much detail with that, but in primary care, we are so, the field is so vast. I see people with all different symptoms, presenting with so many different things, and I'm really blessed to be able to be part of your life. I really want to thank you for that, and I hope I am giving you some valuable information. Some questions out there I have about what's the recovery time. From what we know right now is that usually symptoms may take up to 2 to 3 weeks to develop into a disease process, and you might be really not very sick and recover, or you may get serious symptoms like shortness of breath, cough, high fever, or maybe even a low-grade fever. The important thing is to talk to your physician. Please contact your healthcare providers, your doctors. We're here for you, and then we can try to assess if we need to see you in the office or if it's something that we can directly triage you to our local facility. We're very fortunate to have a local center that can take care of, hospital that can take care of such sick patients. And I really want to say a big thank you to all our healthcare workers for taking care of everyone, continuing to work. I felt it this week. I mentioned some of my friends asked me if I needed any help with running any errands. There are a lot of foods that we have, hopefully, that are non-perishable, that are in our home, and it's time to eat those. Like you may have dry lentils or chickpeas, kidney beans in cans. You don't have to go out and grocery shop every day. Just try to think of things that you have. Maybe a good time to plant a garden at home as well. But everyone stay safe, stay healthy, stay at home, please, as much as possible. I know it's really difficult. Human beings are social animals. Last thing we want to do is be cooped up inside our home. But this is one situation where it's really worth it. I know actually India tomorrow on March 22nd has a countrywide quarantine. Everyone's going to be staying in their home. And I think at 5 p.m. they're all going to come out on their balconies and cheer, clap for about 5 minutes for healthcare workers. I think that's a great thing to boost morale. I think here itself, we are all doing the same thing. Value one another, spread love, spread messages of kindness. Be very kind to one another, even through Facebook and social media. This is a time to really keep our peace, so that we can have direction and the healthcare workers can do what they need to do to take care of the sick ones, and reduce the disease burden and what we call flattening the curve. We don't want this big spike in cases where the healthcare community just cannot meet the demands and have enough resources. The latest update, our South Carolina DHEC has posted that we were able to get 55 pallets of stockpile for N95 masks and PPE, personal protective equipment. So we're very blessed to have that. We need to use that appropriately for patients that need it. And a big shout out to all our healthcare workers. I'm so proud of all of you. And if there's anything I can do, any message you'd like me to share online, please do add. There are a lot of people that are even working in important industries right now, not just in healthcare, but people in supply chain, people that are, required to work in grocery stores. Thank you, Tina, for pointing that out. And they might be sick too. So minimal handling is really recommended. Like I said, even delegating it to somebody else in your community that can do a couple of different errands. It just depends on where you are and what you're doing. But I thank you for tuning in. I don't want to keep this too long. I know everyone's got a very precious Saturday at hand. Take care of yourself, eat a well-balanced diet, and stay happy, healthy. And please listen to the healthcare community in terms of the guidelines right now from what we know. Thank you. God bless. Bye-bye.